Look, a couple of things briefly but specifically about Victoria, Andrews and the state of the nation. We now learn from this Victorian Chief Health Officer, Brett Sutton. Can someone produce his credentials as to why he's suddenly an expert on infectious diseases? I'm told before he turned his mind to this, he was writing papers on climate change. Could that be right? Now he's saying he wasn't part of the curfew. The Chief Medical Officer wasn't part of the curfew, and it had nothing to do with public health. It was an enforcement mechanism. Well, if the curfew has nothing to do with public health, then there should be no curfew. And of course we know, as I've said many times, worldwide experts say there should be no lockdowns. Stanford University, Nobel Prize winning scientist. I see Donald Trump has just been in the last hour nominated for the Nobel Prize. Good on him and good luck to him. But Professor Michael Levitt has said lockdowns are a huge mistake. The Professor of Theoretical Epidemiology at Oxford University, Sunetra Gupta, has urged, quote, Australia to abandon its selfish and self-congratulatory lockdown tactic. And we have now the Andrews Roadmap. Many businesses, funny road this, won't be opening until as late as November. And they're saying the costs could be up to $20 billion to the economy. So three things. Scott Morrison, you've got to make it quite clear you will not support this Victorian vandalism in any way. First point, let's hear it, Prime Minister. Simply and specifically, you won't support this Victorian vandalism. Secondly, this is the worst public policy catastrophe in Australian history. Andrews should be forced out of the job, and the Labor Party should do that, and if they can't, they should explain why. Andrews has to go now. If he wants to appear at press conferences every day, then he's telling the nation he owns this disaster. 6.5 million Victorians deserve better leadership. So first point, Prime Minister, disown all of this and start getting a spine. National leadership is required. Andrews should go. And if the curfew has nothing to do with public health, it should go. And the third thing is this. There now has to be a national advertising campaign to tell the truth. Tell Australians that 99% of cases are mild. Tell Australians that expert epidemiological advice is that lockdowns should not exist. Actually, the Prime Minister said that himself. He said border closures should not exist. Well, take out a national campaign advertising to tell the public the truth. And while Mark McGowan is locking everyone out of Western Australia, the Premier, tell the nation what McGowan said, the West Australian Premier, in the West Australian Parliament on March 18. I quote, if we close the borders to the east, what will happen to our markets and products and supply chains for important goods? Unquote. Tell the nation what the WA Health Minister said on the same day when he was challenged about border closures and Western Australia were not talking about them. Then the Health Minister, Roger Cook, is also the Deputy Premier, he said, quote, well, there is this little thing called the Constitution. I think we should be limiting and minimising non-essential travel in Australia, but we can't turn around and say one Australian cannot meet and visit another Australian. Isn't that amazing? Now no one can visit WA. These people can't be trusted. They say one thing one day and one thing the other. Tell the nation that via a national advertising campaign. As the former High Court Judge Michael Kirby has said, much has to be done to, quote, invigorate and involve Parliament in scrutinising the use of emergency and disaster powers. He said, and I quote, Parliament needs to be questioning in its role so that it doesn't become a tame servant of the executive arm of government, unquote. Well, Parliament doesn't even meet. If we have research from the Australian Red Cross showing that 82% of Australians are worried about catching COVID-19, then fear, anxiety and alarmism have taken over. An advertising campaign is needed to tell the nation there have been no deaths of anyone below the age of 30. Only 26 deaths below the age of 60, and most of those had comorbidities. Tell the nation the Department of Health itself says, quote, only 9% of Australian hospital patients recorded no comorbidity. That is, only 9% of the deaths or the cases were due to coronavirus alone. Tell the nation what its own Department of Health is saying. I can give them the page reference if they like, or if they want to continue the cover-up, let them be nailed for covering up the truth. Their own department said, quote, the symptoms reported by COVID-19 cases in Australia are consistent with a mild respiratory infection in the majority of cases, unquote. And when people are frightened of death, tell them that of all the deaths in the states and territories of Australia, 68% have occurred in Victorian aged care. Advertise and tell the public the truth, that in the 6 months that the virus has raged across the landscape, there were only 232 deaths outside Victorian aged care. 232, 451 Australians die every day. Why are we not telling people the truth? Or are we prepared to go on as we are with 1.3 million Australians underemployed? As of late August, 2 million Australians are jobless. Business is being crushed because we've promoted fear and alarmism and we've failed to promote the truth. Well, I'm challenging the Morrison government. Take out a national advertising campaign and tell the public the truth. And if you're not prepared to do that, tell us why you're not prepared to do it. Let me hear from you. What do you think? A national advertising campaign to tell the truth. Alan at skynews.com.au.